Alright, this is the quick summary of my other video where I went over all sorts of different medical studies on the benefits of exercise for treating chronic lower back pain. So the first thing that I looked at was the abdominal strengthening exercises for treating lower back pain. Then I took a look at several core studies and then ended up with a lot of lumbar extension studies. What I found in the abdominal strengthening study was that it proved very ineffective for treating lower back pain over the course of 2 years. The problem with that study was they did send their participants home and they were supposed to do abdominal exercises at home. These were not resistance-based. They were all bodyweight exercises, and there were a lot of people that didn't work out. As we all know, people don't really work out when you tell them to, so that study needs to have further research done to back it up. When we look at the core strengthening exercises, it was quite interesting that it did provide very substantial benefits in the short term. Now, in the core strengthening exercises, that's your full core, abdominal, oblique, and back, and they used a form of yoga-based training for that. However, once you reached 6 months and 12 months, there was no appreciable difference between a yoga-based core program and another type of core program or a general exercise routine. There really was no difference. So core exercises are good in the short term to relieve back pain, but not very effective over the long term. When we look at the lumbar extension studies, these are where substantial changes were noted and even maintained the improvement over a 1-year period. They did a lot of different studies, and they found that resistance exercise, especially those that isolate the lumbar spine, which requires a machine and the pelvis to be fixed. If the pelvis moved, it was not as effective for lower back pain, and certain machines were completely ineffective for recruiting lumbar muscles. So it did nothing for lower back pain. However, there was a study using normal resistance, such as back extensions, hip extensions, and pull downs, which proved to be very effective at treating chronic lower back pain. What they found is that people that are suffering from chronic lower back pain typically do not have weak abdominals. Where they are weak is their lower back muscles. And one thing that was very interesting to note is most of the people in the study for the lower back issues had tried many different types of treatments. They had gone to chiropractors. Many of them had done physical therapy, and it proved ineffective. What happened is when they experienced even the tiniest bit of pain, they would stop, and they started limiting their range of motion, which further caused degeneration of musculature in the back, and they were very adverse to doing anything that could cause the slightest bit of discomfort, and they had been encouraged by the people they were seeing to avoid anything that caused discomfort. So the studies found that they had to actually force these people to kind of work through the pain in the lumbar extensions, but it did prove effective. There was a very small sample size study done on deadlifting, which found it was very effective in 2 of the 3 subjects for treating lower back pain. However, the 3rd subject was actually suffering from lower back pain caused by a certain type of arthritis, and they did not see any sort of benefit. However, in all of the other studies, regardless of the diagnosis of what was causing the lower back pain, all of them noticed some sort of increased strength, range of motion, and lessening of pain. There was a very small percentage of people that did not receive any benefit, and it ended up being under 15% or at 15% for most of the studies. And these are studies done with anywhere from 30 to 862 people. So a large sample size in the back studies when compared with some of the other studies. So in conclusion, the back exercises worked because, again, the abdominals were typically not the weak link in the chain, and they were using resistance. They were constantly increasing the weight. They were using accommodating resistance, And as the people improved in strength, they tested them and they added weight. When you were doing the core exercises, although they were effective in the short term, the body quickly adapted to the stimulus provided by their own body weight, so they stopped making further improvements. If you want to continue doing core work, you have to figure out a way to make it harder, whether that's increasing the intensity or adding weight. You have to do something to continue to cause accommodating resistance, continue to cause stress, which will in turn increase growth. Also, you cannot be afraid to experience some pain in increasing that range of motion. Accompanying range of motion increase is a lessening of pain, and as you get stronger, the pain is lessened. So if you really want to get rid of lower back pain effectively, the best method you can do is a lower back isolation exercise that isolates the pelvis. If you cannot afford one of these machines, you can do exercises that are similar, such as back extensions, hip extensions, pull downs, reverse hyperextensions, and even deadlifts, which are fairly effective at recruiting the lower back. But you want to make sure that you're strong enough and you master the form when you're doing weight on a deadlift. All right, if you have any questions, comments, or concerns, I encourage you to check out the longer video. It's about a half an hour long. Leave comments below. If you like the video, like it. If you have any comments, comment down below. And if you want to see more content like this, please subscribe.